organization. Please help me welcome AMGA's new president and CEO, Dr. Jerry Penso. Good luck. Thank you.
As I stand on this stage, I am amazed at the journey that brought me here today. And what a journey it's been. I had the privilege of practicing medicine as a family doctor for 20 years, and I took care of all sorts of remarkable people, everything from newborns all the way to 100-year-olds. I remember one special patient, an elderly woman with advanced heart failure, who I visited in her home. Yes, I did home visits. And after one visit, she invited me back to her living room just to chat about her life. Now, at first, I was surprised, but later I grew to treasure those sort of invitations. To be invited into our patients' lives is such a special honor that is bestowed upon all of us here that are involved one way or another in the field of medicine. Although I loved that type of one-on-one interaction with my patients, and I love my practice, I wanted the opportunity to impact even more lives. I became a medical director and designed quality programs that impacted tens of thousands of lives. And later, I was fortunate enough to help other medical groups and health systems replicate those outcomes, first through statewide initiatives, and later through national AMGA collaboratives. Through my work, I met the remarkable Don Fisher. And he convinced me to move from sunny San Diego all the way to soggy Washington, D.C., where I became AMGA's first chief medical and quality officer. But now I have the best job in all of healthcare, because I get to work with all of you, the best and the brightest leaders in healthcare and the most premier organizations in the industry. For 68 years, this organization has been committed to one thing, to helping you better serve your patients. And I am so honored and humbled to have been selected as your next president and CEO. "20 years ago, as a fairly green medical director, I attended my first AMGA meeting, and I soon realized the power of connecting with my peers who understood my challenges, who helped me find solutions, and really enjoyed brainstorming new ideas. One special person I'd like to recognize is Susan Terry from the University of Utah. Where's Susan? Where is she? There's. Thank you, Susan. Susan, early in my career and early in my AMGA career, served as an advisor, a mentor, and really helped me along my journey. Susan later went on to take various leadership roles within AMGA and served on our board of directors. Thank you, Susan. And thank you to all of you here who have served as mentors to others in AMGA. I was then hooked on what this organization could do. For those of you who have realized the benefits of our peer networking, you probably have your own memorable stories to share and your memorable people to share. And for those of you who are new to AMGA, you will too by the end of this conference. You know, it may seem that all of our organizations are very different, that we have different needs, that we come from different regions of the country, that we have different payment models or different management systems, yet I know that we're united around our common purpose, a better care delivery system that improves health. I am very excited to build upon that legacy left by Don Fisher to address the necessary changes for healthcare's transformation. But first, I need to hear from you. My immediate agenda as president and CEO is to visit and to listen to as many members as possible. I want to hear firsthand your successes, your challenges, but most importantly, how we can help you improve. In the member visits that I've done to date, I can tell you we are making tremendous progress in advancing high-performance health. And I believe there are common threads to that success, and let me elaborate. First, you have inspired me with your desire and your commitment to improve and to learn. As Chief Medical and Quality Officer, I've worked with you to improve the care for millions of patients. First with high blood pressure with Measure Up, Pressure Down, diabetes care with Together to Goal, heart failure, rheumatoid arthritis, COPD, multiple chronic conditions, adult immunization, and now obesity. You're not satisfied with just being average. And because of these and other programs, you are making tangible differences in the lives of your patients, and that impresses me. Second, you are deeply involved, embedded in your communities, and setting the foundation for patient-centered, community-based care. Our model of care, coordinated care, is what sets AMGA members apart. And serving our communities well means serving each individual well. Although our patients, they may change insurance programs, they may change employers, yet they remain loyal to their physicians and their health plans, their physicians and their medical groups often for years, if not decades. And you're not afraid to tackle the big, really hard issues that are facing our communities, like health disparities. And you're addressing some of the root causes of poor health, like poor transportation or food insecurity, or now substance use disorders. Third, besides your commitment to continuous learning, and besides your commitment to patient-centered, community-based care, AMGA groups have always been on the forefront of innovations that improve quality, safety, and value. AMGA members were among the first to adopt electronic health records, patient portals, patient registries, analytics, and now augmented intelligence, and virtual medicine, and apps. Unfortunately, there are new healthcare players out there that are creating standalone emergency rooms, standalone urgent cares, or standalone telehealth offerings. And we know from decades of experience that patients that receive care through these type of fragmented service offerings will receive care that is of lower quality, will receive care that is less connected, and ultimately more expensive. Patients deserve better. They need us to use and adopt innovations to provide them the coordinated, connected experience that will promote true value. And fourth, AMGA members are leading the way in creating sustainable systems that measurably improve value. Accountability means much more than payment models. AMGA members are making the essential investments in care coordination, in care system redesign, in quality improvement, and advanced management systems. And this is critical as we move away from paying for sickness and procedures and move towards paying for outcomes and health. Time and time again, it is AMGA members that are leading the industry in creating systems that manage the cost and quality for their populations. You know, I wish I could call out all the incredible things that AMGA members are doing to improve health. You saw just a few examples of that in the opening video. And through the course of this conference, I am confident that you will learn of many more. I believe that we are creating countless good news stories each and every day. My goals for this great organization are straightforward. I want AMGA to have a stronger presence. I want us to have a more powerful voice, and I want us to be more relevant. Our strength depends on the engagement of you, our members, your physicians, your administrators, your patients, your communities, all united around that common vision. And AMGA will continue to provide opportunities for you to engage through our peer networking, through our education, through our quality improvement, through our analytics, through our consulting, and through our advocacy. To create a more powerful voice, we will enhance our already successful efforts on Capitol Hill in order to promote our value agenda. And we will leverage our increasing media presence in order to communicate the great things that AMGA groups are doing to create physician-directed, patient-centered, high-quality, high-value care. We will always be vocal proponents of what we are doing together to create a healthier America. And to be more relevant, we will continue to refine our member benefits so that to ensure that you are able to say, I turn to AMGA to find answers to my pressing problems. It's a new world out there. And AMGA promises to be innovative in our approaches, we will be resolute in our convictions, and we will find fresh ways to help you succeed. Now, I've described a lot of our programs, our services, and our initiatives. But when it really comes down to it, the core of what we do, the reason we do everything we do, it all comes down to the care of each individual patient. Just like my patient who invited me into her life years ago. Yes, there is hard work ahead, but it is exciting and game-changing work. Together, we will create better health for all Americans. And I look forward with enthusiasm, with energy, and with hope as we take that journey together. Thank you.